My name is Allison Payne, and I'll be demonstrating my range of motion checkoff. Range of motion exercises are implemented to prevent contractures and maintain joint mobility. There are two types of ROM exercises: passive, where the patient needs assistance, and active, where the patient does not need assistance. When assisting with ROM exercises, be sure to always support the joint that is being exercised and never surpass the point of pain for the patient. Okay, beginning with our neck, we're going to start in extension, which is just holding your head straight up. And then flexion, and hyperextension, lateral, and rotation. Okay, then with our shoulder, we're going to go all the way up to flexion. And then extension is just laying it down by your side. Abduction is out. Adduction is back down. Okay, and then you're going to do the external rotation and interior rotation. Then you're going to do hyperextension, which is all the way back. Okay, your elbow, place it in extension, and then touch your shoulder to put it for flexion. For your forearm, arm straight out, wrist, palm up is supination, palm down is pronation. Okay, and for your wrist, straight is extension, and then flexion, holding it in, and then hyperextension. Abduction, you're going to move it toward the fifth finger, and adduction, you're going to move it in toward the thumb. For your thumb, we'll move a little closer. For your thumb, you're going to do flexion, opposition, and hyperextension, which is pushing it back toward the radius. For your fingers, you're going to start with extension, then flexion, then abduction, and adduction. Okay, moving on to our hips. We're going to start by, we're going to go ahead and do abduction and adduction. Then we're going to do hyperextension and flexion. Okay, and then your this is extension. Okay, and then we're going to do external rotation, which is rotating the hip out and rotating that joint, and then internal rotation, rotate it in. You rotate that joint. Okay, and then for your knee, you're going to do flexion and extension. Okay, ankle, you're going to do dorsal flexion, which is just pulling it up. Plantar flexion, it's pointing down. And then eversion and inversion. Okay? And then for your toes, I'm going to be explaining those instead of taking my shoe off and actually showing you. But for your toes, you're going to curl your toes for flexion, like we did with our fingers. Okay? And then extension is just having them out.